Small incision, cross two Gelpi retractors for exposure. Shallow dissection from the femoral side. Identify the sac under direct vision. Protect superficial epigastric vessels, especially in females. Reduce contents, GRASP, thin sac with a mosquito, and trim only as needed. Close the ring, mainly with simple interrupted ad bridging wear tents. Avoid compressing femoral vessels or the saphenous nerve. Subcut continuous with key knots. Skin, simple or minimize dead space and bleeding. Post-op analgesia, monitors swelling, restrict activity,